If you want to wear it, that's fine, but we don't want to wear it. We have a right to not wear it.
But what about patriotism?
Yeah, we are patriots.
Masks are making people sick, guys. 80% of people who...
us by not wearing masks.
Well, no, should I stop?
That's the indoctrination. That's the brainwashing.
Should I stop smoking to protect your health?
Yes.
Well, no, but
Yes,
secondhand
because
smoke.
no, here's a good one. Should I start working out so you can lose weight?
It could be an inspiration, but that's less important.
But your health is your responsibility. It's not mine. My health is my responsibility.
Yes, because the COVID
How
spread.
public health works. That's the public side of public health.
No,
Guys,
that's
COVID is the
that's not
flu.
correct.
It's a modified flu.
It's just
Did you know that?
Then why are there millions of people dying?
No, but
Her mommy's a doctor and I'm working public health.
There were the same amount of deaths.
You know Barbara Further?
Yes, I do.
Hi, I'm Tina Desiree Berg, and today we're speaking with Dr. Blaine Pope, who is a PhD and has worked in public health. Dr. Pope came onto my radar because recently in Los Angeles, there's been a lot of anti-vaxxer, anti-mask protests that have been happening. And one in particular was a little bit upsetting and disturbing because it was being held at a grammar school. So we're talking about grammar school age kids now that they were trying to target. So Dr. Pope happened to be there. He engaged with them in a really calm fashion, tried to explain, some of the ins and outs of vaccines and viruses. And so I thought I'd invite him on the show today to have a conversation about some of the things that he was trying to get across to these folks, because we all need to have an understanding if we want to do make the right choices when it comes to protecting everybody, not just ourselves, not just our kids, but everybody, because we are all in this together. It is a public health crisis. So welcome, Dr. Pope.
Well, let me just say, by way of very brief background, my wife had texted me that she had heard from somewhere else or seen somewhere else, perhaps online, I don't recall, that they were going to be in the neighborhood, like a block or two away, but at a major intersection in our city of Santa Monica over here. And I was just like, oh, okay, well, whatever. I'll go pick up my daughter and, I'll do my dad thing and we'll just come on home. And so I go to pick her up, but she herself, I guess, having picked up some of mom's and dad's general intellectual curiosity about stuff, asked me if I would walk her over to just see these people kind of close up and just kind of get a feel for what they're all about. And I thought about it for a second and I'm like, well, they don't seem violent.
Yeah.
No. Yeah, why not? Like, I forgot what the first question was, but in the general vicinity of, why are you doing this? Why, this is a problem, don't you? And that's kind of how the conversation started. And I want to emphasize it really was a conversation. Mm-hmm. And I think, to kind of cut to the quick, at least for me, one of the important things here is I wanted her to see that you can have conversations with people with whom you may disagree, and some of whom you may vehemently disagree, but we can still have generally civil conversations.
Brainwashing.
Can I ask you the question?
Sure.
What's the real issue?
Freedom, brother. Freedom.
Okay, yeah, let's talk about that for a second.
Yeah, the freedom that you should
This is a form of slavery, man. The problem is people are
We have
complying
been
to it.
through slavery. You have not.
I'm saying this is a form of slavery for
We have
all
been
of us.
through slavery.
Yeah, I'm not
We have been
it's not that kind of slavery, though. It's a little different.
Us black people have
Tell me more.
Us black people have
I noticed one of them actually made the reference to your daughter that wearing a mask was akin to slavery. And her response was quite poignant. She said, we already went through that. You didn't. So,
right.
Which I think is important. And I will say I saw the same group demonstrating at the Century City Mall and in grocery stores also. I've seen them in there. They've been traveling around. But they've also said to Jewish folks that it's the same thing as a Holocaust. I think both of these references are pretty offensive because are you kidding me? This is a public health crisis and we're just asking you to do something to contribute to not spreading a virus. So that was really a poignant moment, I think, for your daughter. Did she say anything to you afterwards? How did that affect her?
It's interesting, Desiree. I think it's very interesting. I think it was more poignant for actually many of the people observing the scene from afar than it was for us in that moment. I mean, let's be honest. African Americans in modern United States of America, that's just Monday to us.
Right.
That's not anything terribly unusual for us.
And
I think what's happening is certain people now are beginning to realize, oh, that's jacked up. but it's like,
I mean, it's really offensive. It's incredibly jacked up to compare these two things. And then you sort of wonder to yourself, wow, did this guy even think about what he was saying before he said it? I mean, wow.
Well, my suspicion is, and particularly based on what you've told me now about talking to Jews about it being equivalent to the Holocaust, or African Americans is equivalent to slavery, I suspect they've tailored their message for their audiences, so to speak, in order to elicit certain sets of responses. That would be my guess. Yeah, I think this whole thing is what we call the sharp stick in the eye approach. Go for those things that will get you headlines and get you positions in the news cycle of that day or week or whatever. And once you've got that position in the news cycle, use that to then spread your message. And it's one of those classic situations, I think, where you don't necessarily have to win, quote unquote, you just have to not lose. And by that, I mean, create doubt. Just create, well, that seems interesting. Maybe they might have a point there. Just this kind of approach. That's my sense of it.
So now, from a public health perspective, we need to convince folks that herd immunity basically matters. There's no such thing as a vaccine being 100% efficacious. I can never get that word out. That's just how it is, right? So it's really important that the majority of folks are vaccinated so that there's enough herd immunity built up where that whatever percentage we lose, it's okay, right? But I feel like we're up against a wall right now with that. What are your thoughts there?
I don't know if we're so much up against a wall, but there's definitely obstacles here.
Okay.
And my own impression, and again, let me back up just a couple of steps to just contextualize what I'm about to say. So I've worked in the management of health programs as well as other types of international relief and development programs in a number of different countries in Africa and the Middle East. So my experience is the management of people who are administering these programs. And in the process of doing so, I become aware of, potential roadblocks, bottlenecks, as well as success stories and all of that. So it's more from the program management side that I'm coming from. Having said that, it appears to me, based on that experience, that this is a crowd that is really trying to create a heavy level of doubt. And let me add that it's not just happening in this country. I don't know if you've seen some of research coming out of, or press coming out of the UK.
Yeah.
There's one in particular, Dr. Nafiz Ahmed, based out of the UK, has done quite some research. And apparently, according to his line of inquiry, a lot of the people coming out of the old Cambridge Analytica group have since metastasized and spread out to form other children organizations from that parent organization and are essentially doing the same thing. So there's a lot of linkage to conservative politics, Brexit, climate change denial. On that note, I should ask, just as a litmus test towards the end of our discussion with my daughter, I just blurted out, by the way, do you believe in climate change? No, flat out. So I said, okay, this gives me kind of a sense of what we're dealing with.
Yeah.
And I just told it, as politely as I could, talk like in the tone that I'm talking to you now. I said, okay, guys, I hear what you're saying, but I got to tell you, while we're both here in America, both speaking English, we live in different worlds, because what I'm getting from you is just this kind of broad-based denial of what my daughter and I consider to be very basic realities. You don't seem to be just connected to that. And I'm sorry to hear that. And, I'm like looking at my watch or my iPhone thinking, time to go soon anyway. Guys, what do I tell you? Good luck. I'm not sure that's appropriate, but be well. Take care of your health by whatever means you have at your disposal. But, I have some concerns, but take care. We kind of left on that note,
Yeah. I have some concerns about right.
But yeah, I say that to say that there's been a global push.
Mm-hmm.
And the U.S. is just one whistle stop among many on this global train here.
It really politicized a public health issue in a way that's so detrimental to society. It's really remarkable. I mean, can you imagine going back to a time of polio where somebody would have politicized that? And here we are.
Let me say also, though, as I'm talking to you now, I'm recalling also this, and you may remember, this falls in line with the old Steve Bannon playbook. Yeah. To create as much chaos and confusion out there as you can, destroy traditional systems and structures, or at least degrade them as much as you can, so as to be able to take them over in the aftermath in the wake of whatever is left from the flaming rubble. So in some ways, this really fits with that. It
absolutely does. And in fact, another snippet of the video that I appreciated is one of the protesters, they tried to catch you off guard with this smoking question. Like, he said, should I quit smoking for your health? And you said yes.
Yes. And I could see through his head where he's going, oh, darn, that didn't work. Oh, I'll get that.
Well, it was kind of funny because it was such a poor example for him to pick because, yes, cigarette smoke affects everybody around you. I don't think that's a controversial statement or up for debate. He picked the wrong thing. So then he sort of shifted to should I work out to change your eating habits or your weight issues that you might have, which is a little bit more apropos because at least his eating doesn't affect your weight, right? So these are two, but the smoking one was kind of funny to me. I was like, yeah, bad example. But you handled that pretty well too.
Well, there again, it's an idea of they're trying to determine the terrain on which the rhetorical fight will be waged. So the idea is he chose a bogus example initially of individual initiative and how my individual health is not connected to your health. But in fact, he was dead wrong with that particular example. So then he had to backtrack and figure out another example that might work. And like, oh yeah, if I work out at the gym, does that help you or affect you in some way? Because that in his mind, perhaps it was a little more solid for the point he's trying to make, that what I do vis-a-vis me and my health has got nothing to do with you and your health. And that relates to the concept I was trying to put across, that you're basically deleting the public in public health. This is a team sport here. We have to do things. Look, I've had my vaccine already, but I have continued to wear masks when I go out. Why? Because it's very important that I not spray all over you if I'm meeting you in public or whoever, that I'm meeting with. So for those same reasons, the idea of shedding the virus on others, which I may be fine in dealing with my body, but there may be others who are compromised or otherwise vulnerable.
Yeah. If you were going to give advice to anybody that wanted to engage somebody that was holding these anti-vaccine beliefs, anti-mask beliefs, what sort of tactics would you advise, and what sort of lines of argumentation do you think are the most effective?
First and foremost, I guess it's how you hold yourself. Understand that you probably have a better handle on the situation than someone who's going to deny that COVID-19 is a serious problem. So just be confident in that. And then, how do I say? Ask curious questions. Ask about them. Treat them as human beings. Ask them, how did you come to this conclusion? I really, because I did ask that. How did you come to this? I'd like to know more about you, how you came around to this. And we're judging all the time. I'm not one of those people who says don't judge. I think we're always judging in the back of our minds, but keep those judgments to yourself for the time being and just listen for a while. And, that's basically what I did. Not mentioned, I think, in any of the reports was for the first minute or so, it was just my daughter and these guys talking. And I just listened. And then I slowly began to sort of chime in. But initially it was just her and her intellectual curiosity and me wanting to be there just to guide it and make sure that they didn't get freaky or anything like that. Also, I should add, maybe it means something and maybe it doesn't, but just as an aside, she and I both study martial arts together.
Yeah, nice.
So there's a certain confidence I get. We both do judo.
Absolutely.
Here in West LA. But that engenders a certain kind of confidence in terms of just dealing with people and a certain Not that it's a panacea, but it kind of frees you up to just be relaxed. And God forbid if something should go down, we kind of know how to conduct ourselves, but not worried about that either, right? And so let's just talk. Let's really try to engage in a discussion. And that's not to say it doesn't get heated, maybe like the way I'm slightly raising my voice with you right now, but it's still a conversation. We can have a conversation. I think that's the most important thing. And I wanted her to be able to see that.
Well, I was gonna say, so you never really got to any of the harder science questions then, in that particular situation. But I've seen some of these folks where they've just read enough online where they're like, well, it's mRNA. We don't know what that is. It could be like killing us, or it could be, this sort of thing.
Right. That really takes, how do I say, patience and the understanding that the conversation that I had, now today's Friday, that was Monday, that conversation may not percolate through that individual or those two individuals' heads for another 2 months, 6 months, a year. Do not anticipate that what comes out of your mouth in that moment is some going to have light bulbs above their head.
Right.
That's not, just in the same way that my daughter was there and I want her to remember this 5 years and 10 years from now. So with those men who in many ways less educated than my daughter on certain issues, may not think of things until a year later, 4 years later, 5 years. And, it's the long game here. I guess that's what I'm getting at. I'm not anticipating that they have an epiphany the night after they've spoken with Blaine Pope. If at all, if at ever, it may be months or years.
Right.
And I just resign myself for that. And just, in a way, that's kind of calming too, because I'm not expecting to somehow win points and they suddenly go, oh, wow, I see it now. You're right. I don't think that's happening because they've been given marching orders to kind of go out and proselytize us, we, the infidels who do not get it, and they who do. So, I don't expect any massive turnaround. In some ways, as I was talking to them, I was really talking to my daughter.